Um, okay, I'm gonna start. Our world has been radically transformed by digital technology, smartphones, tablets, and web enab- and web-enabled devices have transformed our daily lives and the way we communicate. Medicine is an information-rich enterprise. A greater and a more seamless flow of information within a digital healthcare infrastructure created by electronic healthcare records, EHRs, encompasses and leverages digital progress and can transform the way care is delivered and compensated. There are plenty of general-purpose EHRs worldwide. However, there are just a few EHRs regarding neurodegenerative diseases, mostly under commercial licenses. In our country, the National General-Purpose EHRs is under construction. Hospitals mostly use commercial EHRs. As for neurodegenerative diseases, there are no EHR in use at the moment except of ours. An EHR is a digital version of a patient paper chart. EHRs are real-time patient-centered records that make information available instantly and securely to authorized users. While an EHR does contain the medical and treatment histories of patients, an EHR system is built to go beyond start clinical data collected and can be inclusive of a broader view of patients' care. Computer tools or applications to assist physicians in clinical decision by providing evidence-based knowledge and the context of patient-specific data are the clinical decision support systems. Examples include drug interaction alerts at the time of medication and reminders for specific guidelines based interventions during the care of patients with neurodegenerative diseases. Our EHR developed under the LAMP model of service stacks for system development, which use Apache Server, PHP, and MySQL. It contains patients' and carers' personal data, geospatial data, medical history, diagnosis, medication, treatments, allergies, and all those things. Psychological tests, neuromotive tests, other questionnaires, and collecting data from HEPA General Hospital, Papa Nicolau General Hospital, Alzheimer Alas, and other clinicians. Our EHR provides accurate, up-to-date, and complete information, enabling quick access to patient records for more coordinated and efficient care, securely saving electronic information with other clinicians, helping doctors more effectively diagnose patients, reduce medical errors, and provide safer care, enabling safer, more reliable prescribing, enhancing privacy and security of patient data, and reducing costs through reduces paperwork and improvement safety. Now, in the beginning, you saw machine learning, but when we say about machine learning, we mean big data. So I'm going to tell you about how we can use big data analytics because our system mainly stores big data. Big data analytics got value in creation of new services, also reduce the cost. Big data technologies and cloud-based analytics bring significant cost advantages when it comes to storing large amount of data. And last but not least, got involved in faster and better decision-making. Challenges that we have to deal with um, in big data analytics. It's capturing data that is clean, complete, accurate, and formatted correctly is an ongoing battle. Healthcare providers may not be quite aware of how vital is to cleanse their data. Frontline clinicals rarely think about where their data is being stored, but it's critical cost, securing, and performance issue for ITs like me. Data security is the #1 priority. Healthcare data is subject to a nearly infinite array of vulnerabilities, with caused from the users of the system if they are not enough, if they're not paying attention, and from users that are not authenticated. It is required to keep patients' data accessible for many years. Understanding when the data was created, by whom, and for what purpose is important for researchers and data analysts. Reporting is often the prerequisite for analysis. The data must be extracted before it can be examined. Must be very clear how reports plan to use to ensure the database admin will produce the dataset that the analyst needs. And at the point of care, a clean and engaging data visualization can make it much easier for a clinician to observe information and use it appropriately. So it's difficult to make this great visualization. Healthcare data is not static, and most elements will require relatively frequent updates in order to remain current and relevant. And finally, data must be can be shareable. Data interoperability is essential. And what's next? We are going to migrate from relational database to NoSQL database. Implement standards such as DICOM and HL7. DICOM standard is for MRIs, and HL7 is for interoperability. We need some extra things here, and we need to optimize the clinical decision support system that we said before. Thank you.